It's Halloween, and there's scary scenes all around as we drive through Charlotte. But believe it or not, sometimes a scary event happens in a dermatology clinic. Today, Dr. McLean and I are going to share with you some of the things we find interesting, you may find scary, but we find a solution for it all. Join us today.
There's no need to be afraid.
No need to be afraid. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started. Dr. McLean, are your kids ready for Halloween?
Sure.
Been ready for a while?
Yeah. I don't know. I'm sorry. I'm bad at acting. I'm just glad Halloween's on a Friday this year.
I'm glad I'm out of town. We're a popular house because we give out full-size candy bars, or we have historically. I've had a hard time getting a hold of them. But I promised our listeners today that we'd talk about some scary things that may be scary to our listeners or to the people we diagnose them in, but we see routinely and sometimes surprise us just for fun. Share an inside peek in a dermatology clinic. And should I start or you?
Go ahead.
Well, this one was very scary for the patient. She tried a new hair color at a hairdresser, and they just went too many shades light. And so she comes to see me. I think she's dealing with it very well, but all of her hair has broken off.
No.
And she has afro curly hair, which grows slowly. We were very concerned, did a scalp biopsy, actually, and didn't see anything wrong, and just started treating her and led her to a full recovery. So something that was clearly very scary to the patient and wondering how she was going to respond. And I thought to myself, boy, I hope that hairdresser is scared. We turned it around. Took a long time, but we turned it around.
How do you treat a situation like that where the damage is more on the hair shaft than at the root?
Well, all I do is guide the patient, and they do all the work. That is home care, babying that hair. The hair shaft is dead. That's a very good point. And when it comes out of the scalp, it's up to us to take care of it, and particularly afro curly hair. So gentle cleansing, and they go through lots of cycles of moisturizing and supporting the hair. And then nutritionally, we support hair growth. And then medically, we support hair growth with medical treatments, whether they be topical or an oral medicine like oral minoxidil. So help the hair grow from below. Think of a crop. We've got roots in the ground. We're going to help them grow. We're going to fertilize it. But when they come up, we're not going to let them dry out in the sun. We're going to take care of it so we get a good harvest, a nice head of hair to style so it looks as good as Dr. McLean's hair.
Oh, well, thank you. I think you know my secret.
No, I do. It's excellent. Excellent. What have y'all been seeing over there on the medical side?
So one thing that we see often is rosacea. And rosacea has many contributing factors, but one thing that patients often find scary are when we start to mention the mites that live on your skin. Those are called demodex. I know you love demodex. I
do.
Don't think I see you as gleeful as when you see a mite
I
under the
find
microscope.
them quite endearing.
They are. So, we're not scared of them here in the dermatology clinic, but I do think that people just kind of have an ick factor when they think about the little mites that live on their skin. But we all have demodex. We all do. It's when you have an exaggerated reaction to it or an over-proliferation of that demodex population that it can be a problem. And patients come in and they look red, bumpy, sometimes even little tiny spikes almost, little hyperkeratotic bumps is what we call it, kind of almost caveman
caveman like.
But anyway, that's a different episode. But so we often treat with an oral medicine called ivermectin, which some people love because it's been in the media in the past few years as a potential cure-all for lots of things, but it definitely works for the Demodex mites and for that type of rosacea. So maybe scary to some, but we love it because we're able to help.
Absolutely. I get gleeful because I'm like, yes, I have found a solution. We have something we can target.
Yep.
Because often red bumpy rashes on the face can be very challenging to treat. So I'm like, yippee, we have Demodex, very treatable. May seem scary to you, but we can treat it.
Another thing we see under the microscope, and we saw it this week, is lice. Yeah.
Unfortunately, kids get back in school and that goes around. And yes, our PA Alexis Lewis very astutely found an egg under the microscope. So again, we get a little excited about that, but we definitely have nailed the diagnosis on that one.
Yep. So no need to be afraid. We can treat, we can get you better, we can get your household less itchy.
Absolutely.
Yep.
Another thing that's scary to patients is actually a scabies infection. That's a mite on the body.
Yeah.
We don't find it often. Believe it or not, you can be itchy all over with scabies and may only have 2 or 3 little bugs on you. So the chance of us finding it are small. And a lot of times we'll treat you and we don't even know it's there. But recently I treated an individual that had come out to help me with my horse. And she's kind of rubbing her belly as she's there. And she's like, sorry, I've had a rash. I'm just so itchy. And I said, well, I'm a dermatologist. And she had previously told me that she's been under a lot of stress. She thought that's why she was itching. Her father had recently died. And anyway, we finished working on the horse. And I'm like, well, let me see your rash. And it was pretty, the medical word we use is excoriated. And that's when you scratch so hard, you've got crust and tears in your skin. And I asked her, was your father in a nursing home? And she said, yeah. And I said, I think you have scabies. And of course, this freaks her out. And I said, don't worry, we can treat it. So, and she apparently, her vet told her she'd given it to her dogs. And it's harder to treat in dogs. I don't know. I don't know that they're the same mite. They may be similar. But she was very grateful. So grateful she didn't charge me for her visit to my barn, which I think is ridiculous. I'm going to use her for some other services.
Absolutely. Bartering.
But these things, while they're scary, they're treatable. And we love it because they're treatable.
Absolutely. On the cosmetic side.
Oh.
What do you find scary over on your side?
Well, what I find scary on my side is the potential for complications. But what's real interesting is that some people actually think they can order a filler online.
Ooh.
And inject it at home themselves. And I've seen this happen. So I've had patients come in with large abscesses on their face. I don't know what it is. There's ingredients in these fillers. We can treat it. We can drain it and inject it, give them oral medicines, oral steroids. There's often a reticence to come in. They're a little embarrassed.
Yeah.
They don't want to confess. But filler gone bad is self-injection of filler. Even worse things can happen with self-injections. You can inject in a blood vessel. The one thing that will drop an injector's blood pressure in a minute, go white actually, is if we suspect it's been injected in a blood vessel. And I've seen that in a patient, not one I treated, so it was several days old. She came in for a skin rash, and I saw a bruise. And I said, what's that bruise from? Oh, my filler, but I'm here for my rash. And it had been infected. It had been injected in a blood vessel. So prompt attention is helpful. Home skincare products can be scary.
They absolutely can be scary, especially when they mix them up and then use them several months later. Because there's no preservative.
Imagine that stuff sitting on your cabinet. That's scary to me. Can you imagine opening that jar where you've put egg, maybe beef tallow? No, or
I
worse.
Can't. Yeah. I cannot imagine that. You know, another thing, and I'm sure you've seen this over your time in practice, is we used to call it the positive bandage sign, or sometimes the hat sign, when patients come in and they're almost embarrassed to show you what's underneath
Yes.
because things have been maybe percolating for quite a while. So whenever I see a Band-Aid on a patient, sometimes it's just covering a scratch, but I make sure to ask, hey, what's under that Band-Aid? Because a lot of times it might be a neglected skin cancer.
Yeah, have you seen one of those? They're unreal.
I have. I know you had a case of something on the scalp.
Yeah, I've had two. One on the scalp.
Yeah.
I can still remember Robin's face when she came. It was actually an 8 o'clock patient. And I thought, well, gee, that's taken a long time to put him in the room. It was booked for a cyst, very common in the scalp. Yes. That's a 5-minute procedure. And he had a hat on, baseball cap, and Robin comes back and she said, this is not a cyst. It was a tumor, a normally benign, relatively benign tumor. It had been present so long, I don't think it had a benign activity, called a proliferating pilar tumor. It was bigger than a salad plate.
Wow.
And yes, we did take it off that day. We didn't get it. Took the whole thing off, but it needed more surgery. It was so big, we had to go to the break room to get a Tupperware container.
To put the sample in?
Uh-huh. I guess I should tell our listeners, if you come here, we're going to give you a solution. We're going to take care of it as best we can, honestly.
Yes.
So after that, it was referral to head neck surgeon. Had another woman, it's actually brought in by her daughter, whom I know. And this was not a neglected woman, but she had just hidden this tumor from everyone, and it literally was a baseball on her back. Mm-hmm. And I guess there was a change, and daughter suddenly had to start bathing and caring for and found it. Mm-hmm. So that size tumor got radiation therapy. Sure. So yes, these things watching. Oh, I know a good one. Foreign body.
Oh, yeah.
Oh, I love it. I'll confess. I love it. And I'll never forget years ago. I'm sure I've taken out so much I have forgotten. It's not even funny. But one I will not forget. Bump in the forearm, new onset. This has been a patient of mine. So I knew it was new. And I was like, I don't know what it is. I was worried about cancer, of course.
Yeah.
So we do a little, what's called a punch biopsy. And I'm in there. And anyone who knows me is I don't give up, except on a Pilates class, bar class. Yeah, forget it. Yeah, no, I quit. I'm like, this is too hard, I quit. But not on getting something out of you. There's something in here. And I'm to tell you, it was a large piece of glass, probably 3 or 4 inches long. And she said, my gosh, that has got to be from a car accident over 20 years ago.
Wow.
It was in there and just suddenly started reacting.
Mm-hmm. I love foreign bodies as well. I think in the past year, I've removed an earring back that was in kind of one of the and a helix piercing that was kind of stuck in the back. This patient had a piercing, decided she didn't like it, took her earring out, but somehow, I don't even really understand the mechanism of this, but the earring back got lodged in there and the skin healed up over it. And eventually it started to become very painful, and she thought it was just a keloid, which is a hypertrophic, large, sometimes painful scar that are common on the ears. But she came in and I felt it and I was like, there is something hard in there. It's not just firm skin. There is something resisting me. So we numbed it up and, just made the tiniest little slit incision, and then you go kind of fishing around, and then lo and behold, this earring back popped out. And
that has not happened. That's amazing.
Yeah, so that was kind of fun. And then the other one that is maybe a good one for Halloween is the game, is it melanoma or a tick?
Oh, yeah, the tick game. Uh-huh.
Yeah, so I remember once in residency, I was at the VA up in Boston, and this gentleman came in, and he was very worried. He was so sweet. He was worried he had a melanoma actually on his scrotum, on his nether regions. Uh-oh. And so we take a look. I give it one little touch, and just this big old engorged tick falls right off.
That was lucky.
Yeah, and then recently here,
the best diagnosis.
Yeah. I mean, it was great. It was not a dangerous tick. I wasn't concerned about Lyme disease, and thank God he did not have a genital melanoma.
That's awesome.
Yeah, and we've had similar cases here with the little nymphs, the little like baby ticks that are so teeny tiny. Mm-hmm. I had a patient who was like, why do I have these little black things? And it turns out when I looked with my dermatoscope, I was like, oh, hello, friend.
Oh, boy.
Yeah, they wave right at you.
Yes, we have two tools. We can see them.
Yeah.
When I was a resident, I was called, I'm going to say emergently, but we were on call at the VA, so all they had to do was pick up the phone. So I think this guy's got a melanoma on his foot. Mm-hmm. I'm like, okay. So I go over there. And this isn't that scary. It was scary for them. They were like, this is not us. We're calling derm. And I said, can I have an alcohol wipe? And I just started, sometimes dirt gets in there. And I made his foot clean, solved the problem, and went on. But foreign body, I did a rotation in ENT. I don't know if you did.
I did not.
They have proud displays.
Oh, things coming out the ear and the nose.
Of what they've taken out. We pale in comparison to them in terms of what they have found. But ticks is a good one. It's an easy fix. But no amount of reassuring makes the patient feel better.
No.
Another sometimes scary topic is nails. Yes, they can actually get really big with what's called onychomycosis or dystrophy, very thick. We do have good treatments for them. So that's something that may seem quite scary. We can, for those of you watching on YouTube, put some scary photos up, but it doesn't have to be that scary. And when they get real thick, I feel you have to use a laser on them in addition to the oral medications. Home wart treatments. Now those, most of those are not scary. They're mostly interesting, but they can do some scary looking things to the skin. It's astonishing to me what people come in with. A few years ago, there was some product, I think it was supposed to burn everything off, sebcays, warts, skin cancers, and it was some black paste, and it was creating holes in people. That was certainly very scary.
Yes, I am not familiar with the black paste, but it doesn't sound good.
No, not good at all.
People do ask me a lot, what can I do at home to get rid of, seborrheic keratoses? Those are the waxy or sometimes even crusty raised spots that we tend to get over many years, or skin tags. What can they do to get rid of those at home? And I say nothing good. I would leave them alone at home.
I think one thing that can be scary to patient is the rapidly growing skin cancer like keratoacanthoma.
Sure.
It literally grows in a matter of days to weeks. Easily fixed, though, so that's another one.
Those are actually some of my favorites because we can often treat them without even needing to do surgery.
Yeah, that is nice. So we've covered some scary things today. And you might wonder, why are they so gleeful about these things? Well, because we can fix them.
Yeah.
That's the nice thing. And when we find them, fix them and carry on. Not the big tumors, of course. Those we're not gleeful about those at all. But some of the things that people think they're scary, it's like the scarier, the Halloween decoration. Your dog freaks out or mine does, and he gets closer and he's like, well, okay, it's just a toy.
So I think it's one of the things that keeps our jobs interesting too.
Absolutely.
You just never know what's going to walk in the door. And it's really rewarding to be able to take someone's fear and allay it.
A peek inside a dermatology clinic. Thank you for joining us today, and happy Halloween.
Thanks for listening to Queen City Skin with Dr. Elizabeth Rostan and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.